Okay, Chapter 4. Most of us are probably familiar with the Lamaze method, in which a pregnant woman giving birth will focus on her breathing and relaxing. Usually this is with a partner, the dad maybe, or just a close friend or family member of the pregnant woman. And very often Lamaze is used with natural births, meaning that medication is not administered at all, or at least not until the very end during delivery. Grantley Dick Reed was a French obstetrician, and he actually taught moms how to relax and breathe and how to involve the dads. His method was known as the psychoprophylactic method. And both Dick Reed's and the Lamaze method were inspired by Pavlov's research. Theorists argued that our society has created a lot of fear of childbirth in women. If we can ease the anxiety that women feel during childbirth that has been classically conditioned, that will help. Before it became normal for women to give birth in hospitals, which was in the 20s, all babies were delivered via home birth. Today, that is actually growing in prevalence, home births. Doulas are common. These are companions that assist the woman with childbirth. Midwives can actually get a nursing degree, plus OB and L&D, or labor and delivery specializations. Most countries actually use midwives during delivery. There are birthing centers in big cities. These are more popular now, but they're only able to help women with low-risk deliveries. If there are problems, the women have to go to a hospital. Even hospitals have tried to make their birthing rooms more home-like and comfortable. Rooming in is also now an option for women and their newborns, in which the newborn rooms in the mom's room. In the U.S., the medical model is still used for childbirth. In the medical model, surgical procedures like C-sections are performed with greater frequency. A third of all U.S. hospital births are by C-section, and yet we know that they're only necessary 5% of the time. More drugs are used, and shorter stays are also part of the medical model that can potentially cause problems for the newborns and their moms. It used to be a week, and today it's only 2 days or 3 days if a C-section was performed. A few weeks before delivery, hormones are released in the woman's body, such as oxytocin. This helps prepare the uterus for contractions and also helps promote social connectivity, which will certainly help when that newborn comes into the world and needs to bond with parents. The baby's head will begin to turn downward unless it's a breech birth. A breech birth happens when the baby's feet are positioned to come out first. Many women experience practice contractions, so to speak, small contractions known as Braxton Hicks. There are 3 stages of birth: labor, delivery, and afterbirth. Labor begins when the water breaks. This is when the amniotic sac ruptures. The uterus begins to contract and push the baby down the birth canal. Contractions can last 25 to 30 seconds every 15 to 20 minutes, and then progress to 45 seconds every 3 to 5 minutes. The woman's cervix will dilate. The duration of contractions depends on the mother's age, her previous pregnancies, and complications. Delivery typically lasts about 20 to 80 minutes. 60 to 65 second contractions occur every 2 to 3 minutes, and this is when the woman is asked to push. Delivery begins when the head passes through the cervix. The cervix is the lower part of the woman's uterus at the top of her vagina. And crowning is said to occur when the widest part of the baby's head is at the vulva. The vulva is the woman's outer entrance to the vagina. Once born, that baby is actually referred to as a neonate. Tearing sometimes naturally occurs between the woman's vagina and rectum to make room for the baby, and sometimes episiotomies are done, in which the doctor actually cuts. Episiotomies are very controversial though, because we're not even sure if they're necessary. Immediately upon birth, the neonate is checked. Mucus is cleared from the mouth. Sometimes a waxy vernix caseosa is removed from the baby's skin, and after checking the baby, the neonate is laid on the mom's warm body. Usually the mom can then recover for about 20 minutes before the afterbirth process begins, and this is when uterine contractions will expel the placenta and the rest of the umbilical cord. Dads and partners are often the ones to cut the cord, and many people are choosing to save the afterbirth for later treatment of diseases. Those progenitor cells in the afterbirth can be very helpful. Frederick Laboyer actually wrote a book in which he talked about how traumatic birth is for the neonate, and he advocated lowering the noise in delivery rooms, trying to soothe the newborn. At the very least, his book led to doctors ending the practice of slapping the baby's bottom immediately upon delivery to get the baby to cry and start breathing. Today, more people actually believe that the stress of birth helps the neonate. It helps expel amniotic fluid from the baby's lungs and prepare the baby for the first breath. Also, stress hormones during the baby's birth help blood go to the organs, boost the baby's white blood cells, helping the baby fight fight off infections and also protect against asphyxia, in which the neonate receives no oxygen. A neonate appears a little bit weird. Very often, if it was a natural birth, the baby will have a misshapen head. Vernix is sometimes still present, that's that waxy covering. Most babies lose their lanugo hair before birth, but sometimes you can still see those fine woolly hairs at birth. These will typically disappear by about month 4. Milia will sometimes appear on the baby's face. These are small white pimples. These typically go away after the first few weeks. The average weight of a neonate is 7 pounds 5 ounces. And the average size is 19 to 22 inches. Neonates appear very often with a receded chin and an underdeveloped jaw, and bow-leggedness and pigeon toes are common. Immediately after birth, tests like the APGAR will take place within 1 to 5 minutes of birth. During the APGAR, doctors will check the baby's heart rate, respiratory function, muscle tone, reflexes, and check the color. The highest score is a 10. 88% of all neonates score between 9 and 10. If they score under a 5, that requires intervention. If they score a 3 or lower, that means they have to be resuscitated. The Neonatal Behavioral Assessment Scale is an updated version of what we used to call the Brazerton scale. Sometimes it's used, but it can also be used up to a week after birth. There are 18 items checking alertness, social connectivity, physiologic and motor development, and other things. Attachment is a huge area in developmental psychology. In the 50s, Harlow conducted a study with infant monkeys and found that they preferred a comfy, furry mom to the metal one that actually delivered milk. They would go feed for a while on the uncomfortable, non-mom-like metal surrogate monkey mom, but they returned immediately as fast as they could to the more comfortable, mom-like, furry version. Bowlby and Ainsworth conducted research on a parent-child attachment in Western cultures. Ainsworth developed an experiment known as the strange situation. It was strange because it was in a lab, which was unfamiliar to the infant. This research identified that there are both secure and insecure attachments between a parent and child. We also now know that there's a critical period for attachment. If an infant does not attach to a primary caregiver by 4 to 7 years of age, they will have significant problems. And it is very important that the attachment process begins immediately after birth, but if a C-section had to take place and so the mom was unconscious for the baby's first few hours, or in cases of adoption, it won't cause insurmountable problems. Research has shown that by gazing at the infant, that helps the infant synchronize brain activity with the adult person the infant is gazing at. The father's bond is very crucial too. We tend to talk too much about the mom's bond. But fathers who implement kangaroo, which is skin-to-skin care after a C-section, help promote attachment, they reduce the baby's upset, and they facilitate later breastfeeding when the mom is conscious again. Fathers help their boys learn how to control their aggression through roughhouse play. Simply having a dad in the house lowers a female teenager's rates of sex and teen pregnancies. Sympathetic pregnancies can occur. This is known as the Couvade syndrome, and it's when the dad actually feels nausea and back pain, much like the pregnant woman does. Research also shows that dads are much more stressed than the moms when premature babies first come home. So dads suffer too. Birth complications in 1 in 10 of all deliveries. Anoxia is severe oxygen deprivation during childbirth. Typically, this is when the umbilical cord gets tied around the baby's neck and cuts off oxygen. This leads to intellectual disability. Rh incompatibility is when the mom and the baby have mismatched blood types. Placenta previa occurs when the placenta blocks the cervix and prevents the baby from moving out. C-section is typically required when this occurs. Low birth weight babies are much more common with the ARTS and also with the multiple births that we see naturally. A low birth weight is under 5.5 pounds and very low is under 3 pounds 3 ounces. Preterm is defined as before 37 weeks. Very preterm is before 32 weeks. Preterm births are seen with much higher frequency among African Americans. Some think that using progesterone and fish oil may delay. Also, they advocate using antibiotics to treat infections, as infections have been shown to speed along delivery. Preterm babies are often at more risk to develop later problems like ADHD. But more than their weight at birth, it's the development of the baby, how well formed the organs are, and how ready the baby is for the world that contribute to complications. Teratogens also often lead to birth defects, developmental delays, and intellectual disabilities. Postmature babies are delivered at 2 weeks after the standard 40 weeks. They're often heavier. Sometimes this is because their moms were diabetic, which means the babies were exposed to higher levels of sugar and may have metabolic issues. So postmature babies are always monitored carefully. Infant mortality means that the baby dies sometime within the first year. It's much higher in African Americans, possibly because of increased risk of living in poverty conditions. It's also higher among women with a lower education, with multiple births, when the mom drank even a little bit, smoked or used drugs, or if the mom has any other kind of a health problem. Sudden infant death syndrome occurs. We still don't know exactly why. Accidents or abuse lead to infant mortality. Birth defects, low birth weight, and prematurity also contribute. Both moms and dads can actually have mood fluctuations just after the birth. Again, dads experience more stress when their premature babies are first released and sent home from the hospital. Postpartum major depression occurs in about 10% of all moms. They're unable to care for their babies. Sometimes they might want to harm their baby. They experience unreasonable anxiety and depression, and very often they don't realize that there's anything wrong with them. This is a chemical imbalance, so these women need to be helped. Some advocate that we should screen all pregnant women for the possibility that they might later develop PMD. Infancy is the first 2 years of life. This is when infants are learning about their world, mainly through touch. They establish competence with their world. Entrainment is something that occurs when it's almost like a symbiotic relationship with the caregiver. What impacts one, the caregiver or the infant, will also impact the other. Infants will gaze at the image you see on the screen here on the left much longer than the right. That's because the image on the left looks more like a human face. At birth, we are social. We prefer a human face to other shapes. We prefer human voices, especially the voices of our moms and dads. Evolutionarily, human beings want to care for infants. Our blood pressure and heart rate will actually go up when we hear an infant crying because we want to help that baby. At birth, reflexes are often checked. Reflexes are inborn and unlearned. At birth, they are present. The rooting reflex is when the baby will turn its little face to the breast. The sucking reflex occurs when you place anything in that infant's mouth. He or she will immediately start sucking. The palmar reflex is a grasping reflex. Tonic neck is sort of like an unguard position that you see in fencing. The face will be turned toward the extended arm, while the other arm is actually cocked up and locked in an unguard position. The stepping reflex actually isn't really stepping like walking, and it will disappear just before it emerges again when the baby starts walking. When doctors check the Babinski reflex, they'll drag a finger along the bottom of the infant's foot, and you'll see the infant spread toes and extend the big toe. This actually disappears as we age. If you see this Babinski in adults, that means that they have a neurological problem like MS. Brazelton identified different states of newborns, ranging from sleep to crying. Crying indicates many different things: discomfort, hunger, frustration, pain, simply needing attention. Drug-addicted babies at birth will cry with a very high, shrill, and long-lasting cry. We know that swaddling or tightly wrapping the infant in a blanket or clothing results in less crying. Cultures that promote swaddling have quieter babies. Infants sleep a lot, 16 or more hours a day. Usually they take 7 to 8 naps, but by 6 weeks, that drops to just 2 to 4 naps and they're sleeping less. After infancy, they're typically called toddlers. Toddlers typically just have 1 nap and they sleep through the night. This sudden infant death syndrome I mentioned earlier is lower today, but it's still a big cause of death. It's higher in Native American and African American populations. It's the number 3 killer after the number 1 killer of birth defects and the number 2 of accidents. Usually SIDS occurs months 2 to 4, but it can occur up to 1 year of life. And there are no signs. We don't know the cause. Some researchers think possibly sleep apnea is a precursor to SIDS. That's when the babies stop breathing periodically during sleep. We know that good prenatal care, lying the baby on its back, not having an overcrowded crib, no blanket, not allowing the baby to become overheated, no tobacco in the baby's presence, so no smoking. Also waiting at least a year between births, good nutrition, and using a baby monitor to let you hear sounds. All of those things can help alleviate the risk of SIDS. Shaken baby syndrome usually happens because a dad, it's most commonly the dad or a male partner, shakes the baby to the point where brain swelling, spinal cord damage, eye damage, and bruising occur. The baby's head doesn't actually have to hit anything. Glassy-eyed, lethargic, and vomiting babies often are shaken babies. A third of them die, a third of them experience permanent damage, and a third of them recover. Oh, and by the way, after the male, the next most frequent offenders of shaken baby syndrome are a female babysitter and then the mother. Used to, physicians would recommend scheduling feedings, but now most people think it's okay to allow the infant to dictate how often he or she wants to breastfeed. 8 to 14 times a day is common. Breastfeeding is best for both the mom and the baby. It was down in the 50s when women first started working, but since 2007 it's been on the rise because we know of all of its great benefits. 75% of all moms as of 2007 were breastfeeding. It promotes skin-to-skin contact, which leads to the release of oxytocin. That's that hormone that helps promote a social bond. Oxytocin also helps milk production and helps the mom's uterus return to a normal size after birth. The colostrum is in breast milk for the first 3 to 5 days after birth, and it has lots of antibodies that can help the little baby fight off infections. In the baby, breastfeeding overall reduces diarrhea, allergies, asthma, and ear infections. It's also more watery than formula, which makes it easier for the baby to drink. For moms, it reduces her postpartum bleeding, returns her to her normal weight, and it might lower breast and ovarian cancers. Any breastfeeding is good, but at least if the mom can go for 6 months, that's extremely helpful. At 6 months, some foods can begin to be introduced into the baby's diets, like mashed vegetables. Breastfeeding, though, does require the mom to commit to this. They have to be able to feed their babies or at least pump their milk. They also can't have infectious diseases like HIV, which can pass through the milk. HIV can actually be passed to the baby at any point, even during delivery. Breastfeeding moms must cut their caffeine, alcohol, and certain foods like broccoli, cauliflower, cabbage, and spicy foods, which the baby may not be able to tolerate. They also need to either avoid or at least monitor the drugs that they take. Some drugs are good, like antidepressants, if the moms need them. We used to think that antidepressants led to the babies developing autism or ADHD later, but there has been no higher risk found in the literature. That's been disproven. Major brain growth occurs during the baby's first 2 years of life. Neural wiring is taking place. By age 7, the child's brain is almost adult size. We also know that environmental stimulation helps this brain growth. So exposing the infant to lots of different sensory experiences will help boost cerebral cortex development. Physical growth is also big during this period, and we do see growth spurts. Babies may actually want to eat more just before they enter a growth spurt. The nervous system develops fastest, and the reproductive system is slowest. It doesn't really kick in until puberty. The cephalocaudal principle that we defined in a previous lecture occurs from the brain down to the feet. A baby will be able to control its head and neck before it can control legs and feet. Manual skills develop according to the proximodistal principle from the spine out. So a baby will actually move his or her entire head to orient her hands on the outside of her body. It's only later that a baby will be able to control her wrists or fingers. In many babies, you'll see repetitive rhythmic motions like rocking or bouncing. That's normal and kind of helps prepare them for later walking. Walking occurs typically between months 11 and 15, and there are stages. First, you see the cephalocaudal control of their head. Then they can control their bodies, their chest, their trunk. Then they're able to sit up. After that, they can control their legs. Crawling is actually when they drag their belly. It's not on their hands and knees. That's called creeping. You see crawling by month 7. Then they start creeping. Hitching is usually when they're seated and they use their arms to pull themselves forward or their heels to push themselves back. Babies can stand without having to use their hands to balance themselves at about 8 months. They start cruising, which is basically walking while they're holding on to things, before age 1, and they can walk unaided before age 1, typically. There are cultural differences and individual differences, though. In Uganda, for example, babies walk earlier, right around 6 months. We think that's simply because the culture prioritizes walking. We used to think that babies could see better up close, but now we actually think that they might be able to see better further away until their muscles develop to the point that they can make out finer details. But we do know that their vision is very poor at birth. They are able to make out some details and absolutely already prefer their mother's face, but they have trouble focusing on things or tracking things following them until about 3 months. They only see one-dimensionally until about 3 to 5 months. That's when they can tell boundaries and can begin to see 3D. At birth, they only see black, white, and gray until about 2 weeks of age when they begin to see green versus red and then continue their color development. By 6 to 14 months, they won't cross that visual cliff that you can read about in the textbook. That indicates that they, at this age, have depth perception. Hearing begins developing actually before birth. 3 months before birth, a fetus can identify mom's voice and often dad's voice too. Even in utero, fetuses prefer voices to other sounds. Now, sometimes the birth process can affect hearing. You can have the birth mucus, amniotic fluid, and vernix that all block the hearing process, but that's quickly resolved. 33 babies are born a day with permanent hearing loss. Some hospitals, many hospitals actually, screen immediately at birth because it is so important to identify hearing loss. There's a critical period for language development. If babies don't sign or hear something by about age 7, it's thought that they will never be able to use language. When you see high-pitched crying in a baby that wasn't born addicted to drugs, that typically indicates there's an ear infection which needs to be treated immediately. Ear infections that go untreated can sometimes lead to permanent hearing loss. The movements that babies make are not meaningless. We actually know that they time their movements to match adult speech, which we think helps prepare them for later speech and language acquisition. Gustation is taste, olfaction is smell, and babies also have skin sensations, which are heat, cold, pressure, and pain. All of that is present at birth, and all of that is evolutionarily adaptive. It's good that babies might recognize that something has been spoiled before they ingest it. Everybody's different in terms of what they prefer in terms of taste, but we know that all babies prefer sweet tastes, especially sucrose, which is a more complex sugar than glucose.